Okay, great. Thank you for inviting me. One quick clarification before I start is how much time do you want me to speak for?
You were supposed to speak for 45 minutes, so you can speak for 30 and we have time for questions. If
30
that's
minutes and then time for questions. Sounds great.
okay, perfect.
All right, let me just share my screen here. All right, can people see my slides?
If you can switch it, like, because now we see the presenter mode. Like
I'll go ahead. So thank you for inviting me to be here today. And thank you for staying so late into the afternoon. And my task today is to talk about the Colorado experience with respect to cannabis or marijuana. And I have two objectives there with that, to talk about our experience. And then I was given the objective of, excuse me, how to help families deal with this issue. So just starting with the Colorado experience, let's see here. This is a map of the United States, and there's Colorado right there in the middle. Western state that's in the Rocky Mountain region, known for its skiing, outdoors activity, 300 days of sunshine a year, hiking, biking, things like that. In terms of the timeline for marijuana in the state, and I think the main take-home point for this is that marijuana legalization has been a process. And it didn't just happen overnight. And so when we're looking at statistics and numbers, we really have to go back a ways in order to look at the change in marijuana use over time. Because as you can see here, medical marijuana was legalized in 2000, so about 21 years ago in the state. And then the medical marijuana system was implemented in 2001. And then in 2007, the state was sued because there was a 5 patient per caregiver limit for marijuana. So caregivers were able to grow marijuana for up to 5 patients up until 2007, and until that lawsuit happened. And then after that, caregivers could grow marijuana for and any number of patients. And so that really opened up the floodgates for commercialization, as Dr. Sabet just talked about. And so that was a big step in 2007. And then in 2009, the Board of Health, the Colorado Board of Health, rejected a bid to overturn the 5 patient per caregiver limit. So again, solidifying the widespread commercialization and having very large marijuana grows to serve a large number of quote unquote patients. In 2009 was also the Ogden memo put out by the Obama administration, saying that medical marijuana would not be prosecuted or would be given a very low priority for prosecution in states where medical marijuana was legal. Then in 2012, Colorado voted to legalize marijuana. And 2014 was when the Colorado retail stores opened up. And so you can see it's been quite a process and quite a journey. It's not just something that happens overnight. It's something that happens, as Dr. Sabet mentioned, rather subtly, and in our case with medical marijuana leading to widespread marijuana legalization, which I'll talk about in a little bit more detail. When I do my research studies and look at changes associated with marijuana legalization, I tend to use 2009 as the cutoff point in Colorado, because that's when we had our widespread commercialization of marijuana in the state, when you had billboards, stores, advertisements on the radio, and in newspapers and other places. In terms of more background, let's see here, by state constitution, somebody can possess 6 plants, 1 ounce of, which is 1 ounce of marijuana. Well, they can have 6 plants or 1 ounce of marijuana, and possessing, displaying, transporting, purchasing, and sale of marijuana is legal in the state. Marijuana is defined as all parts of the plant and marijuana concentrates. So that's a very important detail there. All the concentrates that are made with butane hash oil and other things are considered marijuana. So this legislation, this bill, was written very carefully to favor the marijuana industry, as also something Dr. Sabet highlighted just now. As of September 15th, 2021, when I made these slides, there are 1,180 marijuana licenses in the state. So there are 1,180 marijuana businesses in the state. So as you can see, it's been very widely commercialized and made for profit. Here's a picture of one of those 1,180 marijuana businesses called the Green Solution. So I think it's just really interesting that these stores in and of themselves are marijuana advertising. You can see the neon sign there, and how that is, something that is widely seen by children and anybody who passes by that. And this is the inside of a marijuana store, just to highlight that what it looks like there. And you can see that there it looks a little bit like a candy store. You can see the bright colors and the merchandise for the clothing and the other advertising, and the sweet flavors of the candies that have marijuana infusion in them. And it's a very strong marketing machine that they have going. And when I was on the governor's task force about how to implement legal marijuana in the state, I really pushed for just plain brown packaging for everything. And you can see that I clearly lost that battle in favor of packaging that is much more appealing and much more favorable from an advertising perspective. So that's the inside of a marijuana store. This is some of the marijuana advertising that happens. And so on the left is the Cannabis, which is our main newspaper. The Denver Post has a section called the Cannabis. And you can see that that Santa Claus is being used to advertise marijuana. And so you can see how that would definitely appeal to young people. When we're working with youth nowadays, it can be very difficult and very challenging, because if they've seen Santa Claus advertising marijuana, then it's hard to believe that it might not be a good thing for them. On the right, you see cartoon advertising, you see coupon advertising, you see in both bright colors, cartoons, things that we know disproportionately appeal to young people. So again, getting at the widespread commercialization of the product, which is exactly what we don't want. And we know that from our experience with alcohol and tobacco. Again, in terms of the widespread commercialization of the product, we have billboards across the city and state. Here was one that was up for a long time and was really misleading. States that legalized marijuana had 25% fewer opioid-related deaths. So really trying to promote legal and commercialized marijuana. And, in Denver, pre-post COVID in the last year, we've had a 59% increase in opioid-related deaths. So having marijuana and commercialized and legal marijuana has not protected us from the opioid overdose epidemic. And fentanyl especially has been a huge problem in our state. And so again, opioid-related overdose deaths up 59% in the last year in Denver, which is the capital of Colorado, the state. I think one other thing that's really important to mention is I'm trying to give you a lay of the land and an overview of what it's like here, is that the political lobby related to cannabis and marijuana is very powerful. And here's just a headline here about how the cannabis lobby gains new clout in Colorado as its spending has tripled in the past 5 years. So you can see, and I think Dr. Sabet alluded to this already, that you really develop this marijuana machine that advertises, markets, develops, especially to young people, so they can develop the new young users who turn into the heavy users who account for the profits, and then the profits go into lobbying politicians to create a favorable climate and more advertising and marketing. And you have this cycle here of growth. And I'll show you some of the numbers, how effective that has really been. So one thing that I think you should be aware of is that there's the Healthy Kids Colorado survey that surveys high school students every other year in Colorado. And on the up and down vertical axis, we have the percent of high school students who say that they used marijuana in the past month. So that's marijuana used in the past month. And on the horizontal axis, we have the year from 2013 to 2019. So there's a big problem with this graph, according to what I just showed you. Marijuana was legalized in Colorado when? It was 2012. And in 2009, we had our widespread commercialization. And we voted for medical marijuana in 2000. So we do not have good data with this study pre-post marijuana legalization. So these data are frequently cited by marijuana advocates as evidence that marijuana legalization does not lead to an increase in actual use of marijuana. But the big problem here is that we do not have data before marijuana legalization using this survey. Same thing, this is the same survey here, just in table form. And I'll just go through a few of these numbers here to see how they compare to your country, your state, where you live. But for example, if we pick the second one, past month use here in Colorado among high school students is 20% in 2013, 2015 is 21.2%, 2017 is 19%, 2019 is 20%. Lifetime use, if we go up to the top, in 2019 was 35.8%. One thing that we've seen here, and I'll just take you down to the fourth row, percent reporting a moderate great harm with regular use is hovering, it's been going down, and in 2019 is 51%. So really that number is down from about 80% in before 2013, if we can use some other studies outside of Colorado. So that number really seems to be plummeting or decreasing quickly. So bottom line of this slide is really low perceived harmfulness of the drug in our state. This is another survey that's a community sample. So it's a telephone call to families and to 12 to 17-year-olds. And so the good thing about it is it includes youth who are not in school and youth who are in school. It includes both. The less good thing about this survey is that it's a smaller sample size than the one I showed earlier. But Colorado is in blue and it's on top, and you can see that Colorado stays above the United States national average consistently. You can see here that there was a pretty significant increase in use among youth right around 2009 to 2012, 13, which is exactly when we would expect this increase to happen with the legalization of marijuana. And then in recent years, it's stabilized because we've been doing a fair amount of prevention efforts since then. But you do see, I think the bottom line of this is we do see a significant increase in marijuana use corresponding to the time frame of marijuana legalization. And then we've seen a little stabilization after that. Here's another graph here of 18 to 25-year-olds. So on the up and down axis, we have the percent of 18 to 25-year-olds who used marijuana in the last month. And on the horizontal axis, we have it by year. And what do we see here? We have Colorado on top. And Colorado, I mean, it's just not disputable, has seen a very significant increase in past month marijuana use among 18 to 25-year-olds, corresponding with marijuana legalization and commercialization. And no one disputes this fact. And as a child psychiatrist, I think this is very concerning. We know that the brain is still developing until the mid-20s, especially for males. And we know that this is an age that is really important for social development, career, vocational development, educational development. And this truthfully is creating a lot of problems for our state, I believe, in terms of hiring young workers who can pass a drug test, who are really functioning at the top of their level. So I think this has had significant socioeconomic effects on our state, this increase in 18 to 24-year-olds, really a staggering increase up to 34% reporting past month marijuana use now. This is a study we did early on with marijuana legalization and commercialization, and we asked youth in substance treatment, have you used someone else's medical marijuana? And 74% said yes. And then the table on the right shows that those who said yes compared to those who said no had significantly more days of marijuana use in the past 6 months, had more symptoms of marijuana use disorder, and were more likely to have marijuana use disorder. So what is this graph telling us here? These data are showing us that the quote unquote black market is alive and well, in that youth are accessing medical marijuana and legalized marijuana very easily in the state. In fact, if I had my way, I would get rid of the medical marijuana system, which I think is deceptive. And it also is where most of my young patients, I'm a child psychiatrist who specializes in adolescent substance treatment. It is where most of my patients are accessing marijuana through the medical marijuana system. And why is that? That's because one only has to be 18 in order to access medical marijuana. 50% of 18-year-olds are still in high school. So that means they can become the dealer for the high school. Whereas recreational marijuana, one has to be 21 years old to access that system. And that has further removed marijuana from the young population. So medical marijuana has been a real concern. I think it also just carries a lot of misconceptions that marijuana is healthy and good for young people to use by calling it medical. So that was an important study we did. The impact on the educational system is very interesting. Here we have on the up and down axis the percent of total school suspensions in Colorado that are due to drug use. And what we see here is that right around marijuana commercialization in 2009, we had a significant spike that carried on past marijuana legalization in 2014. And then truthfully, there was a change in policy to where the state just stopped suspending kids for using marijuana within the school system. It was A, overwhelming, and B, there was just a shift in the way of thinking about this and trying to keep those kids in school instead of kicking them out of school. So what's the bottom line from this slide here? That corresponding with marijuana commercialization and legalization, there was a significant increase in youth going to school intoxicated and bringing marijuana to school. Marijuana-related exposures. So these are calls to poison center here in Colorado. And you can see by year, really significant increase in youth calling poison centers or their families calling poison centers related to marijuana exposure. Why? Again, these products are much more potent than they I think I'll just do a couple more. I'll just talk for a few more minutes and then we'll have some time for conversation. This is a study that we published related to driving. On the up and down axis, the proportion of marijuana positive drivers involved in a traffic fatality in the state. So percent of drivers testing positive for marijuana after being involved in a fatal traffic crash by year on the bottom from 1994 to 2011. And the top line is Colorado. The bottom dotted line is other states. You see a significant increase in Colorado compared to other states. So I think the bottom line here is the stories about cars and kids, two vulnerable, innocent populations that are affected by marijuana commercialization and legalization. Percent of traffic deaths that were marijuana related, where a driver tested positive for marijuana, going up significantly, in fact, doubling over time. I'm going to skip this just in the sake of time. So we are in a suicide epidemic in Colorado. And we have one of the highest suicide rates in the country. And this is out of all suicides 20 and older, the percent that tested positive for marijuana. And you see that has increased significantly over time as well. There's a clear, at least, association between marijuana use and suicide. That still needs to be explored in more detail. So the impact on mental health has been very significant. Drug overdose deaths related to opioids have increased significantly in the state over time. So marijuana legalization has not protected us from that. So I do want to say a little bit of good news. This is a paper that we published here showing on the horizontal axis time, on the up and down axis, the amount of THC or marijuana in people's urine when they present for substance treatment in Colorado. And you see a significant increase there. So people are exposing themselves to more marijuana when they use marijuana because it's more potent than it used to be. But the good news is that this is the proportion of negative urine drug screens on the y-axis, and the x-axis or horizontal axis is time. The number of negative urine drug screens that people, adolescents, are giving us during treatment is going up. So the bottom line from this slide is that treatment is still effective. Treatment and prevention is still effective even in the days of marijuana legalization. So the big thing that we have focused on here in developing prevention and treatment across the state is leveraging strong attachment between parents and their youth to prevent substance use and mental health. Strong, warm, loving attachment is what we've been leveraging. And what we've been doing with that on the left there from a policy or society perspective, really trying to promote connection between parents and their children, encouraging parental leave, things that promote economic security, health, access to health care, safety, public safety, substance prevention interventions. On the right, individual interventions, nurse-family partnership in which trained nurses go into the homes of new parents and help them with parenting practices, has been shown to prevent substance use for 20 years after the actual intervention. Prenatal care, reducing prenatal smoking, really promoting infant mental health and bonding. We have an infant mental health psychologist in our hospital so that every baby born in the hospital has access to infant mental health and a great relationship with their parents. Social, emotional learning in schools, great communication between parents and their children, helping parents with emotion coaching and picking up on the emotions of their kids instead of just dismissing their kids' emotions like it'll be okay, don't worry about it, it's no big deal. Instead, really validating and listening to the emotions that their kids have and helping them have the present focus to do that. So those are some of the things we're doing. In summary here, we know that the biggest issues related to marijuana are cars and kids, two vulnerable, innocent populations that have been affected with respect to marijuana legalization. And third point is we can leverage known prevention and treatment strategies, which we know still work even in the age of marijuana legalization in our state. And so with that, if you ever need to reach me, feel free to look me up on drthurstone.com, and there's a way to send me emails through that. And I try to keep it updated with new information about marijuana and substance use in the state. And thank you very much for inviting me to be with you today. And thank you for sticking around till late in the afternoon. And I'll take whatever questions, comments, and concerns that people have. Thank you.
Thank you, Christian, for being here with us. I hope you can hear me. Can you hear me?
Yes.
Perfect. Thank you so much for providing this historical overview of legalization in Colorado and what kind of effects it has given and brought, and also the widespread commercialization you have mentioned, which has also been mentioned throughout the day, but also the fact that there was not really that much data on like before and after. That's why it's hard to compare how it has actually been developing, and that is misused information by the other side. I do have a question from online. You have briefly mentioned the marketing before, and the question would be like, what do you consider to be the most important preventive measure to protect girls and young women from aggressive marketing of addictive cannabis products such as candy, soda, skin cream, etc.?
That's such a great question, because what we've seen, it's actually a wonderful question. What we've seen is it used to be males using substances a lot more than females, and we've seen that equalize recently, and a lot of that has to do with very aggressive marketing towards females. So it's a very timely question, an important question. I think the main thing is, well, not to legalize the substance, because when it's legal, then it has all the protections of free speech and what we call the First Amendment here in the United States to advertise, market, and have free speech. Given the situation that we're in right now, though, where it is legal and it does have First Amendment rights, the best thing I can think of is to have great education campaigns around this. And I think we also need to enforce whatever laws we do have. So, for example, a very nice study published in the last couple of years in which a researcher called marijuana stores, said she was pregnant in her first trimester, and asked if she should use marijuana for her first trimester nausea. And 70% of the marijuana stores said yes. And only 30% said maybe you should check with your doctor first. And the reference for that study is Tori Metz, M-E-T-Z, published that study. So we really need to expose the way that this product is being disproportionately marketed to women, and especially to pregnant women in this time. So thank you for the great question.
Thank you for your answer. Is there anyone in this audience who would like to ask a question before I continue? Then I have a last question from the online participants, which is one. Can you say something about the development of school results from high school and college during this time?
Yeah, so that's a great question. So I had the slide related to increased dropout related to and school suspensions, expulsions. And now the school system is trying to get away from suspending and expelling kids for taking marijuana to school or showing up intoxicated to school. The one thing I think I can say about this is that there's strong evidence associating at least weekly marijuana use with school failure, school dropout, and non-achievement. So strong association between weekly marijuana use and school failure and non-success and dropout. And that's a very robust finding that we find over and over and over, and has been published by the Colorado Department of Public Health and the Environment. And so one thing, if we really wanted to increase academic achievement, we would get very serious about preventing marijuana use among youth, even weekly use, which is considered by many to be casual use.
Thank you so much for your answer.